Documentation. The app has 14 major assessment screens, equipment demonstration, and service device editor. There are 17 report options. To get started, remember all fields with an asterisk are required fields. Logging in. Now I will demonstrate how easy it is to use Mobility Expert. For demonstration purposes, I will use a saved assessment. Depending on your version of iPad, you may find the dictation feature very helpful. I will demonstrate. To begin, I'm going to select this patient. Again, asterisks, fields with asterisks are required data. You must enter information. If you forget to, the program will give you a call out as an alert and advise you what to do next. Medical history, as you can see, very basic. It's not required to have medical history. However, you may find this to be somewhat useful for your total assessments. Now I'll demonstrate how easy it is to use the dictation feature. The patient has a history of a spinal cord injury, period. It's that fast. Whenever you perform an activity and it's a success, such as a save, you will get a success call out. If there's a mistake or an error, the call out will give you the direction of what to do next. We'll go now and look at evaluations. Here are the list of evaluations. You'll notice that some of the evaluations are grayed out and have a check mark to the far right, and some are bold black and have an arrow. The bold black indicates an assessment that has not been performed. So we'll begin by looking at functional mobility. All the app screens work the same, so in instances you may be required to enter a check mark, comments. You can use the program to whatever level you want. There's no actual requirements unless, of course, there's an asterisk. There are some other cool features in the program, and one is the Tinetti score. The Tinetti score is a balance test that allows the user to quickly assess the patient's ability to have balance and and how their gait might be affected with that balance. Many times you'll have a prescription that says gait dysfunction, and when you look at the root cause, it's always nice to have some kind of quantitative measure. So I'll show you how this works. Simply select what's appropriate. I'm doing this randomly. A score of 12 is not too bad. A score of 16 is a perfect score. So again, you have some idea as far as the patient's ability. This is a useful tool also for clinical progression. You may see a patient now that has a neuromuscular condition with expectations that it will progress. And you may see that the scores actually decline over time. Now we'll review some of the assessments that have already been done. The current seating and mobility is I guess it's the beginning point of your assessment. Is what is their primary mobility device? What is its condition? What is the age of the mobility device? Manufacturer, model, serial number, again, not required, but it's good to have that information. Condition of cushion, back, and accessories. And again, the reason for new equipment. Why does this patient need a new device? This begins the process. The home assessment is required with just about every major insurance. It's helpful when you have that also, so you can identify opportunities for improvement. Functional mobility is basically starting very simple. If they can ambulate, they can't ambulate. And there's lots of reasons why a person can't ambulate. So we mentioned having the Tonetti balance score, but you can also add other conditions that might be a factor. Again, if they have a manual wheelchair, are they able to use it? And in this case, unable to propel. A limited ability to manually propel wheelchair due to, and there's all the different reasons. And also, it's not enough to say that they can use a wheelchair. How do they use it? Do they use, is there a propulsion by both upper extremities? Is it a combination of a leg and an arm? We've even added in this assessment a hybrid. So the power assist devices and the length of time that a device like that's used. And then, of course, adding comments. Transfers are really something that we tend to overlook as professionals. We make assumptions about how patients transfer to the bed, to the toilet, to the chair, wheelchair, shower, tub, and what type of assistive device is used for transfer. Activities of daily living, it's a simple checklist. Once again, bathing, eating, food preparation, toileting, dressing, cleaning. These are basically simple questions to the patient. Can you do it by yourself? Do you need help? Do you need everyone to? Do you need full assist, max assist, moderate assist? There's different levels of need, and we give the patient lots of choices, and this helps you to better understand the patient's overall ability to function and live independently. And again, this gives you insight as to how the device is going to have an impact on that ability. And we like to include as well activities of medical necessity. As you'll see, we have your catheterostomy, pain. We think pain is very medication administration. So we can sort of catalog, just giving you a summary of the patient's type of activities that are performed daily and how they're performed. And this is a big focus. How does this affect your lifestyle? And if we're able to provide a device that can alleviate pain or reduce it somewhat, then maybe it'll have a positive impact that can be measured later. The integumentary system has all the reasons for skin integrity, and you can see that every aspect of the skin is addressed, and from the current conditions and of the perhaps pressure ulcers, their staging, their classification, their treatments, methods of weight shift, and also we included the Braden score. So by patient goals are one of my favorite. Selecting the appropriate. This is the reason why we're there. Item in each category can go back and look at calculated. We also added modified risk factors, develop a one step beyond the Brady's patient in terms of their device. This person would be created sort of a moderate choose at 15. All the things. But then if you add in a history of ulcer, neuropathy, paralysis, amputation, and these tend to be measured another perspective that there's some other things. Quite a few the patient might be, and of course, very high risk. You can add new goals. Anthropometrics is another great one. Basically, this is your measurements. This is the thing that you're going to focus back in on when it comes time to prepare and order a detailed product description. You'll have some real metrics to work with. And again, I find the use of the dictation tool very helpful. In this space, we found it to be useful to document what we would call a pre-detailed product description. Just sort of suggestive ideas that you might want to consider when you formulate your final order. Device editor is basically composed of two things, really. One is service, the other is the device. And devices are things that are serialized. These are power bases that have a serialization. They are unique to the individual, they are assigned to the individual, and they can be unassigned as well. They can also be removed from service. So if you are renting, let's say, power mobility devices, you can track the use of that device across many different patients and even its service history. So think of it like a car. If you provided a car, it has many owners and many types of service might have been provided. Well, you can track all that. I'll start with service. We'll add service. The date of the service, which is just a tumbler. The device name. Again, device names would have to be already entered. So you would do that through, and I'll show you in a moment how that works. And you'll see who it's assigned to. There's always the reason for service. We've defined 4 basic reasons: mechanical failure, end user error, normal wear, or other. So any one of those reasons could be a reason for the service. And this is an outcomes measure. So we'll look later to see if there's a reason for service that's a pattern. As you go further down, was this a pattern of failure? Is the device under warranty? These are commonly asked questions, and you'll be able to use that as sort of a guide. This parts, numbers, and description. What I really, really like about this is the ability to take a picture of the device. So we can, in this case, I'll do it from the album. Okay, so we've added a picture. If you have a condition where there's a type of failure with the device, or it's excessively worn, broken, or non-usable, you can use the picture to really explain much better than you can describe that condition, and you can add as many as you like. We can also include a video, which I think is very useful when you look at, like, perhaps rolling a wheelchair and seeing that it pulls to the side, or when you want to add sound even to a device. Maybe it makes a certain type of a sound that you just can't put your finger on. So it's a really nice thing. And also we can schedule then the next service date. So think of it as preventative maintenance built into the program. Devices. We can add devices, we can assign devices, and we can free devices. This one's already entered. So you can basically see the model, the name, the manufacturer, the serial number, warranty information, the date of the purchase, condition of the device. So all these things add up, even a picture and a video of the device if you like. But the idea is that you know what that device is, what it looks like, how it's supposed to look or operate, and it's very useful. So again, devices are unique because they have serial numbers, and components are things that we can add to the device. And once you enter these in, you can continuously add components to a power base because that will be completely customizable in many cases. Or you may not have any components, but the idea is that you can also assign and unassign components. If you look at the left-hand bottom corner, you'll see a home sign. If you hit that, it gives you an alert. Yes, we want to navigate back to the home screen. Reports, basically, we have every type of report. Our philosophy is that if you've documented it somewhere, we should be able to report it. And everything that you can think of is all in here. We have graphs, we have charts, we have patient information, things that you would find useful for the record.